Right now, there are over 1,600 cyclosporiasis cases spreading across the United States. Let's investigate and see why that's happening, right here on the Zyrovis channel. Imagine ordering lunch from your favorite restaurant, and a week later, you're experiencing severe diarrhea, stomach cramps, nausea, and overwhelming fatigue. Imagine investigators can't tell you exactly which food made you sick. That's the mystery unfolding across the United States right now. Health officials are investigating a growing Cyclospora outbreak that has sickened hundreds of people. Fresh lettuce has emerged as a leading suspect, and some Taco Bell restaurants have voluntarily removed lettuce and several other fresh ingredients from certain locations while the investigation continues. But here's what's surprising. Scientists still haven't confirmed exactly which food started the outbreak. Now let's take a closer look. What exactly is Cyclospora? Cyclospora is a microscopic parasite, officially known as Cyclospora outbreak. Unlike bacteria, such as Salmonella or E. coli, Cyclospora is a parasite that infects the small intestine. Once inside the body, it damages the lining of the intestine, making it more difficult to absorb water and nutrients. The results? Persistent diarrhea, stomach cramps, fatigue, and in some people, weeks of illness. While most healthy people eventually recover, the infection can be much more serious for young children, older adults, and people with weakened immune systems. How does a microscopic parasite end up making hundreds of people sick? Unlike viruses such as COVID-19, Cyclospora usually doesn't spread directly from one person to another. Instead, it spreads through contaminated food or water. It also spreads through fresh produce, leafy greens, fresh herbs, and berries. But here's what makes Cyclospora unique. After leaving the human body, the parasite isn't immediately infectious. It first has to mature in the environment. That means outbreaks are usually linked to contaminated food, rather than people infecting one another directly. So if scientists know how Cyclospora spreads, why haven't they found the source? The answer is timing. Most people don't become sick until about a week after eating contaminated food. By then, many have forgotten exactly what they ate. Investigators have to interview patients, compare grocery purchases, trace food suppliers, and slowly piece together the evidence. Sometimes the source is found. Sometimes the investigation takes much longer than anticipated. The Zyrovis take. This outbreak reminds us that identifying a disease is only the beginning. Understanding where it came from can be even more challenging. Public health investigations rely on careful science, laboratory testing, and hundreds of small pieces of evidence that slowly come together. Sometimes the answer is obvious. Sometimes science requires patience, because the goal isn't to find a suspect, it's to find the right one. And that's how future outbreaks are prevented. Thank you for joining me here at the Zyrovis Lab. If you enjoyed this investigation, subscribe for more evidence-based videos exploring biology, medicine, public health, and the science behind today's biggest stories. Because every investigation begins with a question.